Will healthcare be better? I think it will be. I think that's the only possible answer. Either we're going to reduce infections and coordinate care better and give people the benefit of the best possible scientific knowledge every single time, bring excellence to scale, so if one hospital knows how to eliminate infections, all the hospitals do it. Either we're going to do that, use improvement as a strategy, or we're going to end up cutting and holding back healthcare, which I don't think we want to do in this country. I don't think people can or should stand for that. So I think we'll see improvements.
So you're optimistic?
I am optimistic. It's a tough time right now. Contention is high. Battles are politicized. Rhetoric is dominating, and there's a lot of public misunderstanding about where we're headed. It's a complicated terrain. But I trust the public. I trust common sense in this country. Common sense says make care better. You know, the computer you use today probably has 5 times the functionality of one you could have had 5 years ago, and it's cheaper. And that the way they've done that is to make computers differently over time. Every moment, learning how to do things better. Healthcare is exactly the same. We can learn how to make better healthcare every day.
We, in the next 5 years, should capture 30 or 40% of the waste that's in the system, which means $300 or $400 billion a year, and practically eliminate hospital-acquired infections and drive the 300 million medication errors every year in this country down to 150 million, which is still way too much, but it would signal that we're headed in the right direction. We desperately need to realize productivity improvements in health and medical care, because it's the right thing morally and ethically, and it's also incredibly important in terms of the fiscal condition of our country. If we could save money and at the same time make things better, there's no better bargain than that.
Quick question. Do you think we have the will to do what you're saying?
For organizations to have the potential for habitual excellence, they need a leader that creates the conditions in the organization, a value structure, where every person in the organization can say yes to 3 questions every day. First question is this: are you treated with dignity and respect every day by everyone you encounter? Now, I have to tell you, in health and medical care, there's an unbelievable amount of disrespect and lack of dignity accorded people. It's a very hierarchical business. And so I think there's a real challenge for the leaders in health and medical care institutions to create a condition where the people who clean the rooms can say, I'm treated with the same dignity and respect as the surgeon. That's the first question. Second question is, people need to be able to say yes to, I'm given the things I need, tools, equipment, encouragement, so that I can make a contribution to this organization that gives meaning to my life. Not very many organizations where every person can say every day, what I do here gives meaning to my life. And the third question is this: people need to be able to say every day throughout the organization, I'm recognized for what I do.